Well, you just heard from Rusty Surrett that health officials for Brazos County have confirmed the first case of coronavirus that's been confirmed here in Brazos County. But as he alluded to, this was inevitable. Texas had at least 57 confirmed cases yesterday. The CDC and the federal task force continue to recommend more and more stringent policies to try to contain COVID-19. But the message that weaves through the briefings from local, state, and federal health officials is that this is going along according to plan, and as long as we stick to these policies and really take this seriously, there's no need for panic. But to better understand why we are sticking to these policies and exactly what we need to know right now, we are joined in studio. I want to show you how we have our studio set up right now. We're joined in studio by Rebecca Fisher. Normally she'd be right here on the couch with me, but instead we've got her all the way across the studio in our news center. She's an epidemiologist and biostatistician at Texas A&M. Dr. Fisher, thank you so much for joining us from a wonderfully socially distanced space like this. Dr. Fisher, why is the CDC recommending no gatherings of more than 10 people?
Well, I think you hit the nail on the head. What we're trying to do here is really contain the spread of disease. And so this goes back to the very basics of what we know about COVID and the virus that causes it, and that is that it's transmitted from person to person. So if you think about all the people you come in contact with in a given day directly, and then indirectly through touching inanimate objects such as doorknobs or ATM machines, telephones, what we're trying to do is reduce that number of people. So a group of 10, maybe a small group of people, but if one person is infected in that group, that's a limited number of people that can become infected potentially. So when that number was 250 or 500 or 50 even, that's potentially a greater number of individuals that could be exposed to somebody who's sick. Now, it's important to remember that there is a delay between when one is infected with the virus and when one becomes symptomatic. Coughing with fever, for example. So there's a period where somebody may not know that they've been infected with the virus. So you or me or another person in the group could potentially be an exposure to somebody in the group who is uninfected. So that's just important to remember that through no fault of our own and unbeknownst to ourselves, we could be that person in the group. So we really need to be careful who we are in contact with and the number of persons that we are coming in contact with.
Dr. Fisher, I'll admit to you, that has been a personal fear of mine this whole time, is that I could be walking around and have no idea that I'm spreading it to other people, just being totally asymptomatic. I have no reason to believe that. But, you know, just to understand that we're able to carry this thing and pass it on to somebody who it might harm a lot more than it is harming us. Dr. Fisher, what's with the 6 feet thing? Why is that an arbitrary number? Why are we supposed to say 6 feet away from each other?
Right, so this is not an arbitrary number. This number comes from what we know about viruses that spread in this way. So through coughing and through sneezing, the virus is transporting through a droplet in the air. And so 6 feet is really the maximum distance that we expect gravity to affect this droplet that's containing the virus.
As an epidemiologist, as a biostatistician, and watching what's happened, we talked to you before the weekend. Now here we are on Tuesday. Has this been progressing locally? Has the situation been progressing locally as you expected it? And then what do you expect to see in the next couple of days?
So we have been working to prevent this possibility, and now that it's here, it's time to respond. And so our local public health officials and national health officials have given us guidelines, but what needs to partner with that is every individual in our communities. So we have a responsibility to carry out and engage in those activities that are being recommended to us, and this is really what is going to curb the epidemic. So you have heard probably the phrase flatten the curve, and what this means is that we as individuals can do part of this, and that is to prevent the number of people that we're coming in contact with, prevent the opportunities to transmit the virus to others, prevent opportunities for us to be infected with the virus, and then protect others that we have in our families and in our social circles that are vulnerable to infection and vulnerable to severe disease.
Right now, do you think the CDC is doing enough to flatten the curve?
I think the CDC has been doing a great job, and where we are now, they're doing exactly what needs to be done. So they're putting the recommendations out there, and they sound like they're getting stricter, and they are, and we're trying to get ahead of this pandemic. Here, locally, actually, we have a number of cases in Texas. Our one case here in Brazos County, we are in a unique situation in terms of we can actually get ahead of this pandemic. So we've been seeing on the news situations that are in Washington and New York and California and virtually every other place in the United States and our territories. But what we can do in Brazos County is limit that. We can contain that spread. So maintaining our social distances, the 6-foot rule is an excellent rule. Washing our hands, the reason we wash our hands is because we may touch where a droplet has fallen. We may touch our mouth where if we're infected, virus may reside, and then we can pass that on to somebody else and vice versa. Pick up a virus from somewhere and then put it actually into our bodies. So this is how we're going to contain the spread of COVID in our communities here.
I love that you say that we are in a position to get ahead of this, a position like not all communities are in anymore. Okay, Rebecca Fisher, she's an epidemiologist and biostatistician at Texas A&M University. Thank you so much for joining us here today, and good luck with those online classes starting next week.